Welcome to the Board of Health meeting on Wednesday, July 24th at 4 p.m. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner. In person at the Rope Walk Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note occupancy limit of the room may reduce the number of attendees that can be accommodated. You may also join by using Zoom if you wish to join remotely. The link and meeting ID and passcode is on the agenda. You may also send any comment or question that pertains to a current agenda item to publichealth@plymouth-ma.gov. Could be read on the air and answered by the Board of Health as practicable. If time doesn't permit answers during the meeting, responses will be sent by email as soon as possible. So, believe we have a quorum present. We are missing Deb and Amy today. They will not be joining us. I think the owl is talking back to me.
Yeah.
So the first order of business is approval of the minutes from the 26th of June and 14th of
June 26th and July 10th.
July 10th meeting. So does anyone on the board have any alterations, corrections to the minutes from the 26th of June?
No.
Nothing?
No, nothing.
Okay, then we just need a motion by a board member to approve the minutes from the 26th of June.
So moved.
Dr. Reed makes the motion. Is there a second?
I'll second.
Thank you, Mike. Is there no further discussion? Then I'll just call the roll for those present. Dr. Reed, yes or no?
Yes.
Lorenzo, yes or no?
I abstained from the 7:10 minutes, but I agree to 6:26.
Okay, we're just doing 6:26 at the moment.
Oh, okay. Yes.
Deb is not present. I'm also voting affirmative. So I believe we have 4 affirmative and 2 members that are not present. The minutes for the 10th of July meeting. Any discussion or corrections? None? Okay, then I just need a motion from someone who was present for that meeting to adopt those meeting minutes.
So moved.
Dr. Reed makes the motion. Is there a second?
I'll second.
Ed seconds the motion. If there's no further discussion, Lorenzo, I'll skip because you're going to abstain, correct?
Correct.
So Dr. Reed, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes. So I believe we have 3 in favor, 1 abstention, and 2 members that are absent. And next order of business, I'm surprised there's not a huge crowd here today.
Yeah, I am too.
I think, I thought they surely would be. Okay, next order of business is the rodent control and SGAR. Review of online information and authority to draft regulations. So I'm hoping and praying that this will work this time. I'm gonna find out in a moment, I guess. Screen share. And there it is. I hope. Okay, well, so far so good. I'm going to start this as a slideshow. you'll let me. So I tried to sort of abbreviate this as much as I could. So I was gonna make announcements about public participation in this meeting. But I don't see anybody that's logged in to do so. So the general guidelines for our discussion today is we're just going to review some of the online information that's available about this particular topic. We are not going to take a vote of any kind of resolution or regulation. In many cases, I think this has been done in other towns as a policy. So I'm going to go through that. And then if the Board of Health wishes this to also be pursued by the Board of Health as a policy or regulation, someone will have to make the motion. And we will proceed to try to develop that text so that we can vote upon it at an upcoming meeting. So that's how things are gonna work. There is a state preemption clause. And this was really for the benefit of the people that I thought were going to join the meeting. But the state preemption clause is because the state has a regulation about pesticide use, which includes herbicides, fungicides, insecticides, and rodenticides. And it is necessary to state that any town or board or business or persons can volunteer to not purchase and or not use any of these chemicals. As a reminder, this policy is a volunteer effort. If your town wishes to do more to try to ban the sale of these agents, then you would have to actually get permission from the state. If you want to go against the preemption law, which precludes any town from banning the sale or use of a pesticide, then the only way to do it is to ask the town meeting to actually request a home rule petition be approved by the state. So we are restricted in terms of what we can do except for town-owned properties. We cannot enact anything that would impact the way in which the pesticide companies or individuals would actually treat private properties with any of these agents. So that's why there's a state preemption clause, and it is listed on the slide, just so you know, that it's run by the pesticide board in the state, which is part of the Massachusetts Department of Agricultural Resources. It is 333 CMR 13. So that's one of the issues. So we're restricted to doing this only for town-owned properties. It has been done in other towns. One of them is Newbury. And they have enacted a policy, and it was done by the Newbury Select Board on January 23rd, 2024. And aside from the definitions, which I won't go through, in section C, it simply says the use of SGARs, which are these secondary agents that block blood clotting in rodents that consume the poisons on town-owned properties, is hereby prohibited as of the effective date of this policy. So they went ahead and exerted their authority to ban and prohibit the use of SGARs on town-owned properties on the effective date of the policy. And I'm not sure what the effective date was, but select board actually put that in place on January 23rd. They did, however, also state through emergency waivers. And section D states emergency waivers for the use of SGRs on town-owned property may be obtained from the health department. Emergency waivers shall be restricted in time and location and shall only be granted after a well-documented request detailing a significant rodent infestation of public health consequence that has already exhausted all viable, less toxic, integrated pest and rodent management practices. Any waiver granted under this section shall be published on the town's website. So that's basically what Newbury did. And then the town of Arlington did something quite similar, and a matter of fact, the wording is almost identical. And it was also effective on January 4th, 2023. And it's basically the same wording, except under waivers, they also added any other waivers, an emergency basis may be added at the discretion of the department or the Board of Health. So that's basically what was done. Massachusetts State House Bills H 825 and S 487 are a statewide ban on the use of these compounds. And I think I've got something coming up on that. No, I didn't do it. So what's happened is that, these bills are pending, and they have not yet been adopted by the state legislature. And the odds that they would be before the end of the month when the legislative session ends for the 2-year legislative session is probably small. But it's certainly not a given that that's what's going to happen. We have to wait and see. Boston Globe article published on July 18th was regarding the city of Boston's action plan. And they stated the following should be the action plan components. Number one is to deny food sources, especially by educating residents and business owners of property of proper trash disposal methodology. I think we already have that on our website. Number two is to target neighborhoods with the highest concentration of infestations. How you target that is another question. Number three is wield new technology to seek out and get rid of hiding places and escape routes of rodents. Number four is to use if lethal control is necessary, but they stated in this article that lethal control is the least effective way to deal with rats, and better sanitation is best. Somerville has started to use electric smart boxes, which basically electrocute the rodents when they come into the trap to get food. And the city of Boston has started using carbon dioxide. Actually, it stated it was carbon monoxide, but I think it's carbon dioxide. And they try to shoot it with a gas gun down into the rodent holes, access holes. Other things that really need to be done are rodent-resistant trash cans. So walking around downtown not too long ago, like a couple of days, because I was on my way to a restaurant. I looked at the trash cans and said, these would be easy pickings for a rat. There are rat trash cans that are more difficult for rats to enter. We don't have those here, as far as I know, in most places in downtown Plymouth, but some towns do. The other recommendation was to trim shrubs and bushes so that their bottom is about 1 to 2 feet above ground level. Reason for that is rats like to run under cover. And as they do so, if the bushes and shrubs have been trimmed so that there's a 1 to 2 foot space, they tend to avoid that. Rats tend to follow specific paths between their burrows and their food source. And they do it over and over and over again to the point where the grass actually wears out and you can see that it's a track that's being made by the rodents. So that's one way to determine where they're coming from, if you just follow the track back to where they originated from. They also recommended, and if you look at some of these recommendations that came out for the Boston Action Plan, that they actually were putting in place a working group that involved, in our case, it would be town departments along with the Board of Health and the Public Health Department, but also including inspectional services, DPW, Parks and Recreation, Water and Sewer Authority, and Housing Authority. If we had a severe problem, and I don't know how severe our problem is at the moment, we could certainly try to, put together a working group to do that. And we now would have to go ahead and decide on what, based on this information and everything we heard from the people at the last public forum, what are our options? So I'd welcome any suggestions that anyone would like to make, including Karen from a department perspective, about what we should do about this. options would probably include leaving things just as they are. We could update information on the department website. And apparently Arlington has a very extensive website about this that could be used as a model. We could, of course, ban SGR uses on town-owned property. We could also try to put a policy forth that SGARs should not be the first alternative method for rodent control. And that other less lethal methods should be used first. I can't think of any other options. If anybody else can, please let me know. Can you think of any other way to control the rodents? Peg, anything you know?
No, I did watch, I wasn't present for those meetings, I think they were in May, the public forum, but I did watch it. And it talked about, taking away the food source.
Yeah, that's actually on, I think, the department website, in our,
It is.
it's very much, pointed out and encouraged not to put out bird feeders. Certainly not to put out food for pets like dogs in an area where the rats could easily access it. And to make sure that when you put trash out, that it's in a container that rats cannot easily access. That's one of the things that's different for us, Cole, than it is for cities, because cities routinely put out trash in plastic trash bags on the night or the morning of the collection. And by the time that they come to pick up the trash, the rats are already gnawed through the plastic. So, I don't think that happens here. Maybe you
No.
know, Karen, do
No,
people routinely put trash out in plastic trash bags,
No.
not in containers?
no, the private haulers that we have in Plymouth, give their residents plastic, big barrels to use. No one's using, for curbside, no one's using regular trash bags.
So from what I've seen, and of course, Pine Hills is private trash collection that we pay for as a resident at the Pine Hills. What I see as I walk around, yes, we have those same containers. Yes, some people put so much into one container that it sort of holds the lid open, can't be closed.
If a rat's not gonna come on that day, you're supposed to keep, I mean, I would hope that it's not open like that all the time in front of their property.
It is overnight, and I think rats are most active in the nighttime hours.
Then I'm gonna notice that.
That shouldn't happen.
Nope.
And
No, just like if I put a bag of trash out in my yard right now, it's not gonna happen tonight. It's gonna take a little time for them to realize there's a food source. They
Yeah.
don't have like super back in the radar, they know
No.
that.
I would imagine
I
they
have
do have,
outside.
they probably have pretty good senses of smell.
I don't know.
I don't know either. I imagine if there was anybody from one of the pesticide companies, they could tell us that, but none of them here tonight.
I did get some interesting information on the mail about, because I've always been interested in this, but it's the that, the rat birth control.
Oh, yeah.
And it's, soft bait to reduce fertility in rodents. Now, at first I thought this took a long time to actually happen, like,
Yeah.
because, several processes, but it actually says the product line of soft bait will begin to affect the population after 1 to 2 breeding cycles, which is only 4 to 6 weeks.
Oh, that's.
So I thought that was pretty cool. That's super fast.
Yeah.
And it's actually a organic product. It's cottonseed oil, which is the active ingredient extracted from cotton plants. And it affects fertility in rats and mice. The compound interferes with reproductive mechanisms in both males and females, thereby controlling their population. Now, they look gross, but I guess if I'm a rat, I might want to eat it, but it looks like, yeah, I know. Yeah, they do. But anyway, you can take a look at it. I thought it was, I've always thought that process was extremely interesting. New York actually looked into that. I shared with Dr. Poffin what New York decided to do instead was they have dogs.
No.
Yeah.
I think that's really cool. Serious.
Yeah, little
Very-
terriers, a whole bunch of them that
They
go out.
let them out at nighttime.
Yes, they do.
Mhm.
And they have a video, and I cannot believe how many rats those little dogs bring out. One after another, after another, after another. They work for hours and they're happy as can be. Because that's what they're supposed to do.
They kill them.
Oh, yeah, they pick them up, they shake them in the air, and they break their neck, and then they're so happy, and they bring it out to the handler, and they're so excited to drop it off, run back in and
Run
get
back and
another.
They probably get a treat every time.
Oh, you can tell her they're so happy, they're like, yay, and I'm going back to get another one.
So is that practical for Plymouth? And
Yeah, like we're talking-
how would we do it?
Where do you
Well,
keep the
that, the
terriers?
birth control,
Yeah, so this is the, I don't know if I can get
Oh,
one.
yeah, here it goes. Little dogs who hunt big rats. Look at them,
Right, so
there he is.
Oh,
yeah, subways are the worst location in the cities.
Oh, that's the famous pizza rat. He's
Yeah.
famous.
look at them, they're fighting over it.
That's horrible.
I wish I had bought, I can't figure out how to get the volume on this.
And here they
So that's the other thing we can do, I see on there is, we can put signs up.
leftover
Leftover food, or, accessible trash containers. Will encourage that.
So what happens if another animal eats that product? I know something like that came up in the public forum about.
Same thing would happen with mice apparently.
Oh, they eat the birth control?
Yeah.
No, that is specifically for rats and mice.
Okay,
Like, I don't, it's not gonna affect someone else's.
Okay.
It's all, yeah. that's
like the
what I mean.
dog, for example.
Yeah, it's very similar to, we plant rabies as well, and it's only, attracts raccoons. Do you
Okay,
know what I mean? It doesn't attract other animals.
okay.
Curious dogs pick it up, but
So would it also, maybe I can find out by looking at their website, would it also affect like chipmunks? That a lot of people consider cute?
mm,
Probably it would, but I'm just guessing.
oh, do they get paid too? I think they get paid.
Yeah,
Yeah, I think
Like
the,
per rat.
yes, they all just go.
yeah, I think the dog, the handlers get paid.
It's a little Welsh terrier. See,
There you
Oh,
yeah,
look at that.
Yeah,
yep, watch it, shake it with their head, yep.
he's dead.
My auntie used to do that with friend, it's awful.
Oh my god.
Oh, he's getting them to.
He's kicking the dumpster, yeah, and then they go.
You seem to be having fun doing this.
Oh, that's.
Oh, they have, it's just so funny, they're just like so happy to do it.
So if we were to get a dog, a bunch of dogs, who would be in charge of taking care of it? I have a volunteer.
And you know, it's actually, the city of New York pays the people to bring their dog,
Okay,
so it would be a budget line item.
so the dogs don't have to be trained.
No, those are just pets.
They do, well, Dan Ferrand, they do like barn trials where they will
Yeah.
train the dog to do that.
Yeah.
Dan Ferrand is actually a Pilgrim Pest Control, they actually got a Jack Russell Terrier. And they're actually doing that with theirs
That's
right
right,
now.
he brought it to the. farm.
Yeah, so she's very, very little, but that's what they'll do, they'll start with the barn trials and, they teach them how to like snuff them out and go under and stuff, because like my two at home, we have rabbits living under the shed, and they don't know what to do. They don't.
Yeah. Well, but this would be a line item budget
This would actually budgeted,
too.
yeah, because of, yeah,
Although I assume these are available for purchase by the public.
yes. Yeah,
Oh,
Right.
yeah.
but again, like anything else, it would have to be in large numbers in order to take effect. One or two little sausages left along the way isn't going to curb the birth control that we would need for a rat population.
Right.
So I guess we'd have to recruit the pesticide control companies. To, as an initial step, distribute these, food baits that have the birth control in them.
Yeah, that would have to be a long-term project, because it would have to be put out in massive numbers. not just for the limits.
Mhm.
No, that's not gonna work if someone calls you and says, I have a rat issue in my dumpster. Do you know what I mean? Because that's not what that's for. That's actually for a massive launch to
Yeah.
stop the reproductive cycle of the rats. But I think it's very interesting because it doesn't kill anybody. You know what I mean? It just stops you from reproducing. So no one dies. I mean, eventually the rat will die because rats will just die. Because they're old rats. But no one's being killed. It's just, they just can't have any babies. So it stops the cycle.
So the question is that practical for us to use? For the-
I don't know, I think it warrants some additional research, you know what I mean? And I can certainly reach out to Dan. Dan would have liked to have been here tonight, but he's actually on vacation. I can certainly reach out to the other pest control companies and see if they've thought about using it, what the pros and cons are. I just happened to get it in the mail and I just thought it was kind of timely.
So right now is Dan the person who the
He has the
Town.
contract for the town.
contracts?
Yes.
with?
Yeah, and he did also share with me, which I thought was interesting. Dan did, this did not come from Dan, this came from a place called Ratology, Solutions for Rodent Control, and they're out of New Hampshire. So that's who I got this from. But Dan did share with me that his invoices actually do have a section, and he's using me, as this is me, he did like Karen Keene, Director of Public Health, reported rodents in her office. I do not have rodents in my office. There are no rodents in this building. He was giving this as an example. But what he wanted to show us is this. He talks about what he did in the first inspection and what he's going to do in the second inspection. And then there's a products used. I'll pass those around too. There's a products used section at the bottom where he does have to report to anyone who's using him the product that he used, the EPA number, how much he used of it, what day he used of it. So it's not, I guess, a careless application. It has to be a very calculated, no matter what he's using. It has to be a calculated application that whoever's hired him also knows at that time. Which I thought was interesting too.
Okay, so we would have to look through him,
For the town,
for the town's.
he has the town contract, right? Yeah.
Okay,
Yeah, he just, he's had it, and then it just was renewed for an additional year, so actually, I think this month. So this is a new fiscal year, so now he has the contract for this fiscal year as well,
okay. So,
so he would be our contract for the
Okay.
town.
So do we have recommendations now that state that we would prefer to not
No,
use?
that's why we're talking about this, nothing like that exists in the town of Plymouth.
But if we did, then he would be the one that would have to abide by that.
Him currently, and anybody who might come on board later, they wouldn't just apply to Dan, it would apply to whoever the town has hired as their pest control management plan.
And I specifically asked him at that meeting how often he uses it, about how often he uses this powers. And he said probably about 30 or 40% of the time. So it isn't like 100% of the time.
No, in fact, it's not, his, when I talk to the, Dan and other pest control company people, they don't, that's not their number one go-to. That, because when they go to that, there's a problem. Do you know what I mean? And they don't wanna see a problem, they wanna solve the problem. But, for like smaller jobs, they wouldn't use that, they would use other things.
that may not be true of all pest control companies.
Well, I know the three that were at our meeting actually said that,
Yeah,
yeah, they
Like
did.
Darius from Grace
Yeah.
Brown, I've worked
Yeah.
with him before, and I think he flat out pointed out, you know, that. They're going to put it down properly because they don't want people to come back and say, oh yeah, I had the wellness. Job, you know, so, but at the same time, it's legal to use more than what they are able to use, so. It's in their best interest business wise to put down the proper amount to get rid of the altogether. So that they don't have to keep coming up because people are gonna talk and.
Right.
use them, they need to-
we've already been talking
Oh, they
extensively.
do. They do.
So under applicability, under the town of Arlington's, and this came out of the office of their town manager. It says this policy applies to all town-owned property, including buildings, grounds, parks, open spaces and public rights of way shall be adhered to by all employees of the town, as well as third-party vendors and contractors providing services at town-owned properties.
So that would mean the DPW wouldn't be able to utilize it, you know, if you guys said that the town, well. Yeah, that would include the DPW. Whoever we hired to be our pest control person. I don't know if Parks and Recs would actually put anything down, to be honest with you. I think they might leave that for the DPW.
Well, it sounds to me as if anybody was thinking about doing it, the first thing they would do is contact Dan, who holds the contract for dealing with this. right?
Yep,
So they wouldn't do it themselves anyway.
no, but I'm just saying, I wonder if DPW would have access to it. Do you know what I mean? Like some products.
Yeah, I don't know who would know if town, departments can actually audit these very toxic products. I have no idea.
Well, I think you mean like the anticoagulants?
Yeah.
No, I think you have to be like a
You have to be-
licensed test professional.
Because that's what we're, discussing. How do we word it? So that these products are not used by any town official or the contractor that holds the contract for providing that service to the town as a first solution,
Just long.
primary solution. Obviously, if there's a severe infestation, I think we have to rely upon Dan, who's the expert in the field. And, well, have you tried these other methods of control? What have you seen in terms of what's happening or what's causing the rat infestation? And in your professional opinion, do you feel that the other methods of control will not be adequate under these circumstances and SGRs are the only option? Period. So, I hate to dump it on Dan because he's not here even to say anything about it. But if we have to put something forward in terms of a policy to be followed, then I think we can certainly state that these SGRs should never be the first priority for controlling rodent infestations.
Right.
And I think from what
Yeah,
he said, I think he would agree with
Yeah.
that. So I think it's just
Yeah.
a strong recommendation.
Mhm.
So, Lorenzo, I don't want to neglect you because all I see, of course, is the little box on the screen. Do you agree with that pretty much?
Yeah, I've been, listening to the forum, we had, if I could oversimplify it, we had one side, the left hand, and one side, the right hand, and you had the folks that were against it and for it. I think, we know that Plymouth is a large town that has both rural and urban areas. And, I acknowledge the concern on the one side of using SGARs where, there's potentially an impact for raptors or the natural predators of rats that eat this, that they could be impacted by it. I heard that, in the forum, and that was a concern of mine. But, and then the other part of it was the integrated pest management. I know on our Plymouth site for rats and rat abatements, I was just looking at that the other day and I brought it up on my computer, rat prevention and abatement. We do talk about it and it's good education, right? That's what we want to do is educate, but maybe to the extent that we recommend or put a higher level, around IPM as front and center is something that as a board of health that we could do anything to make it more primary as a method or approach as a framework, integrated pest management. Because I did hear at the forum, the pest management companies all talked about IPM, that it's a good thing, but they also said, let's not take a tool out of our toolbox, right? And part of IPM does, at the end of the day, it's kind of the last resort to use SGARs. So coming back to my opinion is that I wouldn't necessarily, I would start to focus on, you know, education, just kind of highlighting IPM, maybe even to a point that the Board of Health passes a resolution, a recommendation that we acknowledge IPM, understand it, and we believe that's a best practice, and we should do that in Plymouth. And then, you know, from an urban and rural standpoint, if we get down this road, and I'm talking about, you know, increase like preventing or banning these SCARs, I wouldn't necessarily, that would be kind of the third, you know, much down the road from a Board of Health perspective. I wouldn't go off and start banning that, but let's start with promoting IPM and a resolution around that, and then we'll see from there. Because to your point, Dr. Potvin, how big is the problem here? What's the magnitude? I mean, I understand, you know, SCARs are poisons, and they impact, like I said, the raptors and the natural predators, but it's also something, a tool in the pest management company's toolbox that I would be hesitant to take out unless it was really a big problem, right? So,
I should also add that one town actually wrote their regulation or policy such that if anyone was using, any company was using SCARs on privately owned property in the town, they would first have to get permission from the health department or the Board of Health to do so. That was ruled illegal by the courts.
Yeah.
So you can't even do the conditional, well, you can use it, but first you have to get it okay. So we can't do that either. So if I understand correctly, you are saying that we should develop a policy document for integrated pest management that emphasizes, at least on town-owned property, that other non-lethal methods should be given priority, and that SCARs should be used only as a last resort when there are severe infestations that are not going to respond to other methods. Is
Yes.
that basically what you're saying?
yes.
Okay, so it would be a pretty short policy statement.
Yeah.
Yeah,
Okay, so I will try to put that, you know, using these other towns' policies as a guide. But instead of banning SCARs, I will word it so that they will be regarded as a last resort if other non-lethal methods are not working or not appropriate because of the nature of the infestation.
Right.
I think that's probably that's the best we can do.
Yeah. I mean, from the banning perspective, you bring up the Massachusetts State House Bills 825 and 487. I mean, that could be answered through that process, right? We don't even know how that's going to play out.
No, we don't at the moment know how those are going to play out. I could probably find out just, I mean, anybody can Google Mass State House Bills H 825 and S 487, and you will see the bills and you will see their history in terms of have they gone through which committees at the House, at the Senate? What action did they take on those bills? And where are they currently at in terms of the approval process? We don't know.
Right.
But it's easy to find out, and I will do so before the next meeting when we take up, you know, possible IPM policy for the Board of Health for an official vote. And hopefully Dan will be here at that time to discuss it with us. Is that acceptable to everyone? I'll just poll the board. We're not gonna vote, we don't have to vote. but,
yes.
You'd say yes. Lorenzo, is that acceptable to you?
Yes, I think that's a step, you know, progress.
Okay, and Meg, does that sound reasonable to you
Yes.
also? think the only other thing we can do, and I guess you can communicate this to Karen, is if she would look at the town of Arlington's website. There is a lot of information. Amy found it actually, and she said there was a lot of information there that is the same basically as what we have on ours. But there's even more
We
information.
might have gotten some advice from you. But we can certainly look again.
Yeah, it doesn't hurt to have a look at it
Yeah.
too.
Yeah, we can
And
do that.
I really don't want to take any further votes on that because Amy made a point of saying that she couldn't be here today. But she really wanted to be part of any vote that was going to occur about that particular topic. And I think we need the pesticide company
Yeah.
that Hackstone has the contract here with us too before we do anything. That's gonna require an official vote.
Well, and I think he'll be able to give you a better idea of exactly what type of management is needed on town properties.
Yeah.
Because he sees them all, where he here in this room have very limited contact.
Okay. So and I'll try to put something together for the next meeting, and we have to discuss when the next meeting is gonna be anyway. So I wanted to thank Ken Stone for coming. He's here because of the discussion, that was promised about, basically styrofoam issues. But you're welcome to participate in any of our other discussions too. So another thing that's come up recently, and there's more data that I have managed to extract, about measles cases and, immunity. So the first case in Massachusetts was reported recently, and it's the first one in more than 4 years. So that's kind of troubling. It was diagnosed in early July in an adult Worcester County resident who had traveled internationally. That seems to be common at this point for where this stuff is coming from. There are 5 cases in New Hampshire. There was a previous report on July 9th that there were 3 confirmed cases found in Vermont and New Hampshire. In the United States, there have been 13 outbreaks so far in 2024 about measles. An outbreak, as we know of from public health exposure, is a kind of a small but contained set of cases that seem to be in the same sort of geographical area. And so that's happened in the United States. It's not the same as a pandemic or an epidemic. That is more widespread. So there've been 13 cases, but the problem is that previous year, there were 4 cases in all of 2023. And so far, there've been 13 outbreaks in just a little more than half the year. So that's concerning. There've been cases reported in 30 states so far this year, and most of the people who are infected mostly unvaccinated with the MMR vaccine, which is measles, mumps, and rubella. As of July 11th, there were 167 cases in the United States in 24 different jurisdictions. 84% of the cases were because of unvaccinated individuals or individuals that didn't even know whether or not they'd been vaccinated. 11% had had 1 dose of the vaccine, and 5% had had 2 doses. 46% of the cases were in children under the age of 5. I don't know if you want to go on and sort of elucidate that more. Why are children, Dr. Reed, why are children so prone to this at the ages of 5 and under, as opposed to even older children, you know?
I would think it would have to do with their immunity, their immune status being less developed.
Yeah, if the mother is already been vaccinated and therefore has some immunity against the disease,
That helps,
do they pass that along to the fetus?
yes.
They do.
Yeah.
Okay, so some of the younger kids probably have some, but not complete immunity against measles. Right?
But they do get their first dose when they're a year old, or
Well, they're-
if they get their
they're
first
supposed
dose.
to.
it would be a year.
Barry, where did the outbreaks possibly enter?
I don't have that information handy, but I imagine I can find out by doing another Google search of it and see where it is.
think it was in the Midwest.
Yeah,
That's what I'm wondering, like, if it's what parts of the
I think it
country.
was the Midwest.
Yeah, with more on this.
I did look longer. I think I have more stuff about demographics of this, but, I did mostly focus on New England. Because that's where we all live. So the other problem is that, these new cases, 53% of them ended up hospitalized. So, I mean, this is a pretty darn severe disease. If you get this, you've got at least a 50-50 chance of ending up in the hospital. And I don't think most people want to do that. It is extremely contagious. There's some kind of reproductive index, which is how many people will one person infected likely infect also. And for this disease, it's about one person can infect 10 to 15 other people. As opposed to COVID, which we've got a lot of vaccine experience with, and the same index was 2. So this is vastly infectious than even COVID. And it's quite a hazardous sort of disease to have. So in terms of immunity protection, MMR provides lifetime protection against measles, but much less for mumps and rubella. So the other two diseases, I think everybody knows what mumps is. Rubella used to be known as German measles, as I recall. I guess they changed that because that would not be politically correct to use anymore. But I remember having both measles and what at the time was known as German measles, now known as rubella, when I was a pretty young kid. I didn't get mumps, and you would know if you had mumps. Does anybody have anyone that you know of that has had a case of mumps? You did? You remember what it was like?
Yeah, big swollen.
Big swollen glands.
Very sore throat.
It's especially hazardous for adult males. Because if you get mumps as an adult male, it can actually cause infertility. And apparently, it's quite painful and a rather personal part of your anatomy. So it's something you certainly don't want to get. Took a long time before I was convinced after I was married that I should be seeing a doctor every year. And of course, one of the questions is what vaccines have you had? And what diseases have you had? As they take your history down. And I was directly asked, so you had measles, you had German measles, like did you have chicken pox? You know, I had chicken pox. Well, that means, you're probably gonna need to get, shingles vaccine. We'll put you down for that right away. Did you have mumps? I said, I don't remember having mumps. Would you know if you had mumps? I guess you would. And so he said, before you leave, I'm gonna have you stop by the nurse's office. They will give you a mumps vaccine. So I didn't even get to leave the office. I mean, he wouldn't let me out. 1 or 2 doses of the MMR vaccine is recommended on or after the first birthday. Is that true? You don't usually give this until they're at least 1 year of age? Okay. And that holds true for preschool or adults that are not high risk. 2 doses are recommended for school-age children or adults that are high risk, including college students, healthcare workers, or international travelers. So does anyone know, does everybody know, have you had 1 dose of the MMR? I've had 2. Do you know?
I know.
My mother.
I couldn't go to college. with it.
Yeah.
You can't live there without it.
Yeah, so, I mean, those of us who were born before 1957 were protected against measles, but maybe not so much against mumps and rubella. So I'm pretty sure when the doctor said, have you had mumps? And I said, no, what he gave me was MMR as a second dose. If I had only had one as a kid. So, if you were born before 1957, 95 to 98% of the children that born in that period were exposed to measles as children, and they do have lifelong immunity against measles. I'm not so sure. Do you agree with that? Or is it maybe not lifelong 100%?
Well, I I had it and they still gave me the MMR, so somebody must have thought that it wasn't necessarily keep you your whole life.
Yeah,
But it's a theoretical that if you get the disease, you should be immune then.
and so if you're unsure of your vaccination status, and there are some people who don't even know, one dose of MMR is recommended for adults, especially including women of childbearing age. Because I guess that's because you want to pass along the antibody to your fetus.
Well, you also, the mother shouldn't get the disease while she's pregnant. That's,
Because she would also infect the fetus.
she infects the fetus, but that causes the fetus bad things.
Like,
Like
miscarriage.
yeah.
Yeah. So also international travelers, healthcare workers, those with HIV because they're also immunocompromised. And anyone else that's immunocompromised for anyone else. There are people who shouldn't get this vaccine. And if you go online, you'll find that it's better to check with your health provider before you get it. If you're not sure if you ever had it and you're worried, to make sure that it's okay for you to receive it. If there's no questions about that. I wanted to update everybody also about COVID-19 because more and more people that you know are starting to come down with COVID-19, and it's a small fraction of the ones that are really infected because nobody or very few are testing anymore. And nowadays, I think a lot of people are getting rather mild cases because of previous vaccinations and probably don't even think it's worth going into the doctor's office. Where if they did a COVID test, it would be reported to the state and to the CDC. But if you look at what's going on in the United States, early indicators, and this was test positivity through July 13th. And if you look at the early indicators, currently week ending, this is for 1 week's data. 1 week's data ending on July 13th, 12.6% were positive tests. Emergency department visits, 1.6% of those people ended up going to the emergency department. 2.5%, actually that's, now you're dealing with per hundred, it's a rate, so it's 2.5 per 100,000 population ended up hospitalized. And 0.9% of all the deaths in the United States are still due to COVID-19. So for those that think that everything is over with and done, and COVID-19 is no longer a concern, it's wrong. It's not as big a concern, but it's definitely still a concern. This is what I was thinking of when you asked, do you have data for measles? And I was confusing it with COVID. This is the current state of what's going on with COVID in the United States. And this is done with a nucleic acid amplification test, which is better than the ones that people are using at home. And if you look at the coloration here, I've got to move this way so I can see it. You notice that the orange states are the most. Those are, believe it or not, apparently Hawaii and the western states, of which there's 3 in a particular Health and Human Resources test area. Most of the rest of the country is all yellow, which is not quite as much COVID, and that includes all of the New England states. And it also includes Alaska and apparently Puerto Rico. And green, which looks like it's including Pennsylvania, Maryland, I guess Delaware, and I guess that's West Virginia, are a little bit less than even most of the rest of the country. So that's what's going on with COVID there at the moment. If you look and see, well, what do they say about positivity in the past week in the country as a whole? It's 12.6% positivity in the last week. It's 10.4 if you look at 2 weeks. So what that means is that it's gone up if you compare the 2-week number to only the past week. And if you look at 4%, 4 weeks, it's all the way down to 9%. So what that should tell you is that it's going up. it's going up slowly, and the percentage positivity is still quite low, compared to what we were dealing with before. This is something I thought was interesting, because it's just people who are traveling internationally. And so they did a genomic survey, and this is the positivity rate, and you notice it goes all the way up to like 30% positivity. And if you look at the way this curve is going, and I think this only goes for the calendar year. Yeah, it starts in January. So it was pretty high in January, probably not to be surprising, because it usually is transmitted, if it's respiratory, a lot more in the wintertime. It dropped, it stayed lower, it dropped even more. But what's troubling is the end of this. So if you look at, whoops, gotta go back one. If you look at this, and you look at the dates on it, you notice that the most recent data looks like it's finally plateaued. But obviously there was quite a large increase among travelers that were traveling internationally. And it went up as high as it did last January. So bottom line is, if you're gonna travel, you better have your COVID vaccination up to date. And even then, you may still get sick. And if you look at this, it shows you again for the calendar year, what happens in terms of all of these variants that are popping up. And people thought that this wasn't happening anymore. It is. And if you look at these colored boxes, you see this dark purple color. That predominated for almost the first, I don't know, half a year. But you notice it gradually fell. And instead, what's going up now seems to be in this pink area. Pink area is predominantly the one that's increasing. So that means there's another variant now that's gone up and is the one that's responsible for most of the infections. If you look at the whole world, just to keep in mind that this is not completely gone. Total reported deaths are 6.3 million people have died of the coronavirus. The last weekly figure, from a 56-day trend, and also the last week, there were 9,177 deaths worldwide. So it's still there. If you look at total confirmed cases, it was 550 million people actually got this worldwide. And there's been 5.3 million new cases. And so you see that little graph on the far right side, that's showing you the 56-day trend. Deaths haven't really changed, but there's been an uptick in new cases worldwide as well. Down at the bottom, it says US, India, and Brazil have the highest number of confirmed cases, followed by France, Germany, and the United Kingdom. So depends on where you're going. So the next thing we have on the agenda, which hopefully won't take very long, is we discussed last time, when I don't think you were able to join us, Lorenzo, changing the dates and the times of our meetings and frequency of our meetings. And so, Karen, can you summarize what you told us last time for Lorenzo?
Sure. So I did reach out to the folks who coordinate the meeting rooms, and we could use this room where we're at. It's available the first and third Wednesdays of the month, starting at 4 o'clock, with no one coming in after us. Meaning that, if we wanted to start a little later, we could, and go a little later, because on the Wednesdays that we have now, which are the second and fourth Wednesdays of the month, we have another group that's coming in right behind us. So we do not have the ability to extend our meeting out a little further or start later and extend further. So that is available. We wanted to change to the first and third Wednesdays of the month, with the ability, if the agenda was full, to extend past 6 o'clock.
Okay, and we can also start later if we so choose.
Yes.
So we didn't get your input last time, was also, what would make, I assume you would probably, do you have any preference in terms of first or third Wednesday instead of second and fourth?
I don't have any preference really. But more of a time, right? So if we could start later, that would be great. That would be better.
Okay. That's exactly what
just me.
Amy, yeah, well, Amy was saying, and I think it holds true for anyone who is currently working full-time.
Mhm.
Because it's difficult for Amy to get here, you know, for a 4 o'clock meeting. She told us she had to leave work at what, 3:30?
Mhm.
In order to get to a meeting in person at 4 o'clock. And I assume you're in the same kind of situation, correct, Linda?
Yeah, but I'm also cognizant for the department, right? It's a long day on these days. So to me, I'm already used to coming at 4, or if this opportunity to be virtual, you know, I think probably 75% of the time, the meetings I attend virtual, and then 25% I do show up sometimes.
Okay, we did discuss that with Karen last time also, because we were concerned about the same thing.
Yeah.
And basically, if we started at 5 and went until 7, that means that the department personnel would have to stay an extra hour.
Mhm.
But, you know, I got the feeling that, you know, that was not a huge problem
Mhm.
for the department members. However, it would be an even less of a problem if the meetings no longer were always every 2 weeks.
Right.
So what we discussed last time, just so you know, Lorenzo, was that we felt that at times we need more frequent meetings. And those times are generally times when there's a lot of variance requests.
Mhm.
And at times when we get a new set of tobacco sales violations appeals. Because we get flooded. So those are the things that are drivers, I think, of our frequency of meetings. So we could do one of two things. We could change to the first and third Wednesdays of either month, and I believe, Karen, you said you already reserved the room for
I
us?
did,
Okay.
Yep.
For both of those dates.
Yeah.
We could change it to 5 to 7, but we can also say that we will always meet at least once per month. But if we do not have any overload or large numbers of variance requests or tobacco sales permit appeals to deal with, and it looks like a relatively kind of mild, not packed agenda, that we could simply either try it experimentally or once a month and see how it goes. Or we could just say, we're gonna keep it scheduled for once or twice a month. But if we don't have much to do, we will simply post that the meeting was canceled, before the meeting is actually held.
Mhm.
So that we have some flexibility in doing it if we have to. Any preferences on board members? Dr. Reed, do you have a preference
I don't,
between those? Meg?
No.
Lorenzo, do you have a preference about how we will go about this?
No preference. I'm very flexible.
Okay, because, you know, it just depends. I think the first and third would work out better for other reasons too. As you might recall, we run into a problem at Thanksgiving and Christmas. Because at that point, if we get into second, the second of the month, that's getting close to when people are traveling for Thanksgiving. It might be even worse if it was the third Wednesday of the month. But at that point, we can say, well, you know, we've been canceling the second meeting of the month in November for quite a long time because of Thanksgiving holidays. What happens at Christmas? Well, same thing, but maybe not quite as severe. But if you start dealing with the fourth Wednesday at Christmas time, people don't want to come to meeting.
It's actually Christmas.
This week it is Christmas.
This year.
This year it
it's
is Christmas.
well,
Yeah.
So that means there might be travel issues going on the third week too, but again, we have the option of saying, okay.
Yeah.
We will meet now on the first Wednesday of the month. In November and December, that's what we'll do unless there's some urgent need for an additional meeting. So with someone, I think there should be a motion by the board. I think we need a motion that we're gonna move to the first and third Wednesday of the month instead of second and fourth. And we need, and to include in the motion, or make a separate motion, that the time will be changed from 5 to 7 instead of 2 to 4 to 6. And that, you will leave it up to, Karen and myself, to decide if the number of things that the board has to deal with is adequate to justify 2 meetings a month, or if we can just have one. So you're investing us with a bit of a decision-making capacity, but no one else is gonna know. Unless you want to be involved in that decision also, because you would probably know it ahead of time also. Dr. Reed.
Yeah.
So if we're pondering, not having a meeting, and how should we, if someone would make that motion, then we'll decide what to do in terms of our meeting in August.
So there's really three motions. So the first, I think, so the first motion is that I'd like to make is that we move the meeting from the first,
From the second and
from the
fourth,
second and fourth to the first and the third Wednesdays of the month.
okay? Is there a second?
Second,
I'll say.
I think Meg beat you.
okay,
So if there's no further discussion about that, and I think we already discussed it, I'll just call the roll for those present. Meg, yes or no?
Yes.
Lorenzo, yes or no?
yes,
Dr. Reed?
Yes.
Myself, yes. 4 in favor, 2 members not present. Would you like to make the second motion?
Sure. The second motion has to do with the timing of the meetings that should be changed from 4 to 6 to 5 to 7.
Okay. Is there a second to that motion?
yes.
I'll say.
I was expecting it was gonna be Lorenzo, that's why there was hesitation.
Yeah, no, I'll second. Thanks, Meg.
Okay. Motion is made and seconded. If there's no additional discussion, I'll call the roll again. Meg, yes or no?
Yes.
Lorenzo, yes or no?
Yes,
Dr. Reed?
Yes.
Myself, yes. It's unanimous. We will move to the meeting, not only first and third, but also the timing until 5 to 7. Starting with our next meeting on August, whatever the date is in August, someone probably knows.
Well, the next one we should talk about is if you're going to have that in August, because I will not be here on August 7th, which is the first Wednesday in August.
Okay.
So, and I don't know, do I need variances?
Would anybody be available from the office on that date?
I mean, I could do it a couple of minutes to hold it, it's up to you.
Okay, so why don't we, well, when will you be available to decide?
I'm not gonna be,
I know, not that day, but in terms of the agenda setting sort of thing.
well, see, that's an interesting thing too, because now we're already on the 24th. Which means you and I usually meet the Thursday before, which means we'd have to meet August first. To be done for August 7th.
Right.
Or we skip August 7th and we start August 21st.
So we should just, decide here and now that unless there are emergency circumstances, there will be no Board of Health meeting on, I guess you're saying the 7th
Correct.
of August,
And we'll pick it up again on the
but there will
21st.
be.
Yes,
Which means that we'll have to plan it on the 15th.
yes, yes, yes. Yes, I'll be back. I'm back on the 14th.
So if that is acceptable, let's just make it formal with a vote. Would someone like to make a motion that the meeting on the 7th of August is going to be canceled unless it is needed on an emergency basis?
So
Okay, is there a second to that motion?
I'll second.
Meg seconds the motion. If there's no further discussion, I'll just call the roll again. Meg, yes or no?
Yes.
Lorenzo, yes or no?
yes,
Dr. Reed?
yes,
Myself, yes. It's unanimous.
Okay.
So if we have to have another meeting,
Yes.
we will decide around the date the agenda has to be put together. And at that point, it'll either be posted as a notice that the meeting has been canceled, and the next meeting will be on the 21st. And if there is an override of emergency and we have to have the meeting anyway, the board members will be so notified.
You don't have to post it that's been canceled, because the select board is doing every other, they just post when they're having it.
But they meet every week, ordinarily, right?
Not necessarily, lately they've been kind of flexible,
Hmm.
yeah. Yes, we don't have to say it's been canceled, you have to say it's been canceled, post it.
But
So-
on the department website, there is an indication of the dates the meetings are gonna be held,
Okay,
right?
well, I guess we could then, so
So that's
let's do that.
what's on the department website would have to be altered from second and fourth to first and third.
Yeah.
Yeah, that would change this.
Mhm.
And the time will change. If the website also says 4 to 6, we're gonna make it 5 to 6.
Yep,
Because everyone needs to know ahead of time. And I guess we also need, the office to notify septic engineers of the changes.
nope. We'll just let them know when they come in to give us a plan.
Okay. Okay, so I guess we settled that, and I guess we've made some people on the board happy. I did notice that there was some discussion, I forget who it was, but somebody who was leaving one of the boards was complaining that there's a dearth of volunteers, and some of the boards and committees are no longer being filled by volunteers. And hopefully this change will make it a little bit better for people who want to be Board of Health members. Because it's not as demanding. The downside, of course, is it's kind of disrupting usual dinner times,
Snacks.
but we can live. Next order of business is going to be, styrofoam. Styrofoam takeout containers, so I'm going to once again attempt to share, and I've got stuff for this. Where is it? Should be here. No, it's not. Thought it was there. Had it a moment ago. Let's see if I can find it again. Okay, so it's a blank slide, that's why I'm not finding it right away. Because I put spacers in, which is kind of deceptive. It must be this one. No, it's not that one either. I'll get it eventually. One more try and then I'll give up.
Don't give up.
Where could it be? This is PowerPoint slideshow. Aha.
Yeah.
Succeeded. So I wanted to point out what's going on with styrofoam. It's also known as expanded polystyrene. So I just spoke to a member of the, I think he's a member of the State House. Bills H 3627 and S 1328, which is the Senate version, were reported favorably by the House Ways and Means Committee on the 25th of March. They are currently somewhere in the legislative mix, and they have not been sent back to the committees for further study, which is the kiss of death. They are still possibly going to become something which the House and the Senate will vote on before the end of the month and send to the governor. But just to give you an idea about the extent of these polystyrene bans, and they're always done by, at least in towns, everyone I saw was done by a bylaw. But you could see a list of the towns that have already put these, the states that have already put these in place. So there's quite a few of them. The closest one to us are Maine, New York State, Rhode Island. In the case of Rhode Island, it's not becoming effective until 2025. I assume the reason for the delay is so that the businesses that are currently using these takeout containers that are made of styrofoam will have some advance warning and have time to utilize their supply and to restock themselves with non-styrofoam takeout containers instead. So that's what's going on at the moment, state, in terms of the states and House bills in Massachusetts. This is the text of the bill. I'm not going to read through this because it's too long. But if you go through this, it says under C, except as provided herein, on or after August 1, 2024, retail establishments shall be prohibited from selling or distributing polystyrene food service ware to customers. Well, obviously, this wouldn't work because the state is currently involved in trying to pass, or hasn't even decided if they're going to pass these bills. So if they do go further with this on a Massachusetts statewide basis, they obviously would have to change the effective date. Department would promulgate regulations for enforcement of the section. Said regulation shall establish fines not to exceed $1,000 for a single violation and the process for deferments in accordance with the following. And there's some reasons why they might get a deferral on an individual basis. Food establishments granted deferral must reapply prior to the end of that period and demonstrate continued undue hardship. If it wishes to have the deferment extended, deferments may only be granted for intervals not to exceed 1 year. So there's more about this. Then down at the very bottom, it says, of course, the municipal health department or its designee may approve the deferral application in whole or in part, or and with or without conditions. So as usual, when a state passes a law, they dump it upon the local health departments and all the local boards of health to do enforcement and to consider deferments or even, appeals about fines and penalties for violations. So it's on here, so I will forward it to everybody at some point so you can read the text if you wish to. So why is this being done? And if you look at this by city and town in Massachusetts, you find things like, why do you not want this in your takeout container? Well, number one is it leaches styrene, a known carcinogen, into food and beverages, especially if those are hot inside the containers. The stuff degrades, if at all, very, very slowly. And as it does degrade, it does produce microplastics. For those of us who have encountered pyrostyrene takeout containers, or even worse yet, but we didn't do anything about this, packaging. So many times if you get packages and delivered to your home, you'll find styrene, micro, little tubular sort of things, or you find big pieces of styrofoam. And if you try to get rid of that stuff, as you have to somehow, first of all, I don't know, maybe Ken would know, are there any licensed recycling facilities in Massachusetts for polystyrene?
Yeah, there are. The one, well, there were a
Yeah,
number.
let me make sure you need to identify yourself. Why don't you come and sit instead of in the bench? Because the owl likes to see you.
I know. One of the few things that do. There is a facility in West Bridgewater that will recycle EPS. The problem is that it needs to be clean. And it needs to be white, and it needs to be clean. And so if it has any food products on it, stained ketchup, they can't recycle.
Okay. And what happens to it when they recycle?
Gets put into things like insulation, products of that nature. But again, they tend to take the kind of big boards of white styrofoam that you get in packaging and so forth. Consumers are highly unlikely to collect their clamshell styrofoam containers to transport themselves out to West Bridgewater. Not put these in your recycling bins. You can't recycle them at the transfer station. So while they could be recycled, if they happen to be perfectly clean and white, the likelihood of them getting out to West Bridgewater is next to No,
Yeah,
Yeah, non-clean styrofoam and the styrofoam peanuts and all other packaging goes in the trash compactor at the Manamet transfer station.
so it goes to some landfill, some,
or to, in our case, we go to CMAS.
CMAS.
Yeah,
so is it possible to include that in hazardous waste? Like bi-yearly turn-ins, or is that,
I don't believe so.
because again, people then have to hold on to it for, what, 6 months at a time?
Yeah, and I don't think, though it is been identified as a carcinogen, I don't think it's been labeled as a
Hazardous
hazardous waste.
Yeah.
If not in this country,
Not all, yeah, in other countries.
maybe in California, because California always does it first. But in a lot of other countries, they seem to do things more rapidly than we do here.
Yeah.
Okay, so currently, my last count that I could find, and maybe you know more than I do about this, there were 6 Massachusetts communities that have bylaws that are prohibiting the use of these styrofoam takeout containers.
You said six.
60, 60.
62.
There are now 62, okay? Because I did a search and I had to go one by one because I couldn't find any place where they're all listed together.
The Sierra,
The Sierra Club hasn't. But, you know, the ones I did find online were Nantucket, Great Barrington, Amherst, Arlington, Hamilton, Brookline, Sudbury, Acton, Salem, Danvers, Melrose, Newton, Somerville, Yarmouth, Ipswich, and Reading. But obviously, there's a lot more than that.
well, in our region, it's about 10. We have Easton, we have Nantucket, Queens, Wellfleet. They're on the south coast, Eaton and Abington. So,
Okay,
it's fair number.
and would you happen to know, if any of them were done by, other than by,
I don't believe so.
because everyone I looked at was all bylaws.
Yeah, I think they are. I don't think it's been done by regulation.
Okay,
It could be.
and so, Karen, if the Plymouth Board of Health decided to work with the department to put forth a bylaw, as is the case in 62 other towns, prior to the state doing their job, the deadline for doing this, obviously, we could not do this for the fall town meeting.
Correct.
There's no way on earth.
No.
So it would be the spring town meeting. I couldn't find the deadline for submitting warrant articles, but I assume it's usually sometime in February. Right?
Maybe earlier than that. For the spring and April?
Spring is usually early in April sometime.
April, yeah, I thought it was.
And this is there's 2 town meetings in the spring. There's a general, or regular
They're
town
held
meeting,
together.
and there's a special town meeting.
They're held at the same day.
This would have to go before the special town meeting,
Correct.
'cause I did my homework.
Mm-hmm.
So at least previously, when I looked at the warrant article deadlines, the deadline for the regular town meeting was actually earlier than for the special town meeting. Is there a reason for that if they're the same day?
Yeah, because the regular town meeting just fine. Special usually doesn't deal with any borrowing or financing or anything like that, so. Closer, you get closer to the date and still be okay meeting all the deadlines.
Okay. So it might be in February, you're saying.
Yeah, I think, I thought it was earlier, but it's
Yeah,
February.
because it's actually, like for. See, this one,
I couldn't
it
find it.
actually closed December 20th. For the
December.
annual town meeting.
Yeah, what
And
about
then
special?
special be January 2nd. No, I'm sorry, that's when it opened, closed February
Yeah,
2nd.
but that was for this current year, not for 2025.
Right, but that gives you an idea. of-
That's why you-
So
That's why I thought it would be-
It's still December.
I thought it would be February.
Yeah, but truly the beginning of February.
Right.
Yeah,
So if the Board of Health wants to pursue this, I'll show you the other thing that's on here that I wanted to bring up too. I Googled health risks from polystyrene and found long-term exposure to small quantities of styrene causes neurotoxic symptoms like fatigue, nervousness, difficulty sleeping, hematological complications like low platelet and hemoglobin values, cytogenetic complications like chromosomal and lymphatic abnormalities, and carcinogenic effects. The acute health effects are generally irritation of the skin, eyes, and upper respiratory tract and gastrointestinal effects. Chronic exposure affects the central nervous system, causing symptoms such as depression, headache, fatigue, and weakness, and can also cause minor effects on kidney function and blood. And styrene exhibits its toxicity to humans as a neurotoxin by attacking the central and peripheral nervous system, and has even been found to affect menstrual cycles in women. So this is nasty. There's no doubt about it. And I don't think we can go overboard as an initial step. I talked to Ken about this, and I think we agreed that as a first step, trying to ban the styrofoam takeout containers, which are dual clamshell things, and I assume the drink cups,
Yeah,
would be a good first step as a new bylaw coming preferably from the Board of Health and the department.
no, I agree, and including the cups is important because we know that heat, goes opposite, transfer. Even more so.
Yeah.
So,
And so, in terms of the arguments that come from the restaurants and the vendors that I've seen online, is that it's going to be much more expensive and there are no real alternatives. I don't think that's true anymore. A lot of the places I go now use these cardboard takeout containers. And some of them, if they don't use that, use other kinds of plastic.
Yeah.
I know the plastic bottoms are not recyclable, but the tops that are clear or translucent are. Correct?
give that last one to me again.
Usually, I find a lot of the takeout containers that are, if they're not using the cardboard and they're using plastic, they use a hard black bottom component and a translucent or clear top,
Clamshell.
Yeah.
clamshell.
The clear, if you're a fanatic like me, you'll cut off clear plastic top, and if it's polypropylene, it can be recycled.
And some,
Styrene, so even if it's rigid.
and the black bottoms, even though they're made of stuff, you can't recycle it.
No, the optic readers can't see it in the sorting, so they go right to the.
Okay. So that's before the Board of Health or decision-making process. It's obviously nothing we have to do immediately. But I'd like to know if the Board of Health, majority of the Board of Health would like to pursue a possible warrant article to put a bylaw in place banning the use of styrofoam takeout containers, both clamshell for food and cups, going into effect at some point after it's passed, if the meeting decides to pass it, which would then ban its use. I'm not sure, I don't think we can really ban the sale of it easily without a lot more fighting.
Well, if you're talking about, probability to be, probably be more resistance to go into.
Yeah, it's not gonna.
Yeah, I mean, my feeling is, especially since the state is involved in this too, apparently, at some point. Because usually the state does it after all, a lot of the cities and towns do it. Because they don't want to see a lot of variation, but trying to ban the sale of it when it's for sale at surrounding towns just doesn't make sense.
And you don't see that much of it in the retail stores anymore, although the dollar stores and some of those carry a lot of it. But I don't see a lot of it in the big markets, et cetera. They still put your hot chicken on a hot styrofoam tray, cut this right around. Leave there.
Yeah. For those of us who know the hazards, that makes us go.
I think that you might want to consider too, obviously bringing in, article before town meeting involves, going for advisory finance, going to all the, precinct caucuses, going before the committee of precinct chairs. Even prior to that, I think you should have a forum.
I believe we do. Most places do. If you're gonna start putting forth a possible bylaw, I think you have to have a forum. So probably the motion we have to make is that at some point, preferably before the end of the year, the calendar year, we need to schedule a public forum on a possible town meeting warrant article for the special spring town meeting that would effectively ban the use of styrofoam, clamshell takeout containers or styrofoam cups. And get feedback, and I know we'll get a lot of people from restaurants that are gonna come in that'll probably be upset with us.
You know, honestly, I'm not so sure.
Yeah, I don't think-
A lot of restaurants
I
aren't
don't think so.
using them and there are options.
Yeah, I mean, there's more options than there used to be, for sure.
What about the styrofoam coolers? Like I had to go to Shaw's today down on, Cecil, is that where? And they, you know, the big coolers, I mean, they just got in a huge shipment of them while I was there waiting. And especially where we have like so many bodies. It's a very popular thing to just grab a cooler like there and load it up with everything. And then that gets left behind. Do you wanna?
Yeah, again, we run into the same situation where if you can buy them in the next town over,
Yeah,
what good is it going to do us to do that if it's gonna cause probably the whole ban on restaurant use of these things to maybe go down at town meeting?
Is that what, the state is looking at, just the ban of restaurant use? Or the ban of any use?
I think I would have to do it myself. I'd have to look in more detail
Yeah.
at those bills which are pending before the state legislature, do you know?
Well, I think when they say retail, they mean
Sale too,
Yeah,
but it would be easier for us, I think, is my opinion anyway, to do it without impacting the sales. Assuming that eventually the state will, or we can come back with another request for another bylaw.
I would agree, most of the towns in the past have just done BEPS, it's been used for restaurants and takeout, so. It's a higher. And if you go into retail, then you have to think of exclusions, for example. Our fishing industry,
Yeah.
they do not have good shipping, product distance, so they have to. So it's a little simpler to do what you're
Yeah.
doing.
And I noticed that when I decided I was gonna be a good brother and send my older brother down in Texas, a 80th birthday gift of a New England lobster bake.
Where to get there.
It came in styrofoam.
You don't have.
He enjoyed it anyway, because I didn't start lecturing about.
They do sell an alternative, I saw that, Market Basket one time, they had an inexpensive alternative to the styrofoam. As a disposable cooler, yeah, they had it for one season, and that was it. Probably.
part of the cold, yeah.
I mean, some people reuse.
Oh, yeah.
You absolutely can.
And there's not a big problem with doing that. It's better than throwing it into the trash.
Well, here at home, will often have styrofoam in its case.
Right.
Yeah. So I guess the motion we need is to, try to schedule a public forum on this particular question involving styrofoam takeout containers. And I think we have to do it, probably, maybe we should say before the 1st of December. Because we have to have time after a public forum, and Karen, you're suggesting that before it even goes in for submission to the,
I just think
To the town meeting.
it'd be valuable to get the public's input before we actually start putting it together.
because then it has to go to advisory and finance, it has to go to the select board for approvals, correct?
When you actually have your bylaw?
Yeah.
Yes, absolutely. Yeah, and legal. It will be reviewed by legal, but someone will present before committee precinct chairs, advisory and finance, select board, and then all of the precinct caucuses and at town meeting.
So it's advisable to have that available for sending out to those groups. Probably what? January, does it have to be December?
No, I mean, we'll find out when the select board will stop putting it on their agenda. And then they basically tell you when you're going. You know, I mean, we'll let them know. Who does the warrant? It used to be,
I think does Kelly do
is Kelly doing
it? I think so.
it? Okay, so maybe the town clerk will say, you know, well, they'll announce when you can actually, put a placeholder. You know what I mean? So we can say that. Along with the Board of Health would like to placeholder for, the special dealing with, the ban of polystyrene for restaurants. And then they'll put that down, and then we go from there.
Okay. So I guess just to make it official, need someone to make a motion to do a public forum based upon the potential warrant article to ban the use of styrofoam takeout containers. And we should probably try to do that in either, I would guess, either a September or October Board of Health meeting,
Okay.
unless you feel that it's gonna be so big a thing that we should schedule a whole separate public forum, separate from the meetings.
No, I think that'd be necessary.
Okay.
Because I believe Ken is correct. I think most restaurants are changing over. And they know this is coming. This is gonna be a shock to anybody.
Okay,
Yeah,
I hope that's true.
Well, I think it is.
yeah.
I think it,
And we're not alone. There's 62 towns have already done it. The state has been
Yeah.
pressured into doing it too.
Yeah, and I'm sure like some of our restaurants that are chains already have places in other towns that they can't do it, so they know that it's, you know, gonna be happening.
Okay. So someone make that motion for the public forum.
I make a motion for a public forum to discuss
Mhm.
the,
Your warrant
recommendation
article
of-
would be a warrant article to put forth by law banning the use of styrofoam takeout containers.
that.
Okay. Is there a second?
I would second that.
Yeah, Meg seconds it. There'll be plenty more discussion, so I'll just take the roll call vote again. Meg, yes or no?
Yes.
Lorenzo, yes or no?
Yes,
Dr. Reed?
Yes.
Myself, yes. 4 in favor, 2 absent.
Okay.
just as an aside, or to add to that, the other thing that isn't mentioned as a benefit is with regards to the litter. That doesn't portion of the litter, and because it's toxic, it does leach into the environment, whereas if it's cardboard, it's out there, it's still a problem, not the same.
Yeah, I mean, all kinds of nasty things come out of landfills. And it's a big problem.
Yeah.
Yeah.
I mean, in Duxbury, we just found out on the Public Health Excellence Grant that they had a problem with PFAS. And eventually they had to take one well water supply offline, and it was coming out of an old landfill. Which is bad. So, wait, thanks for coming, Ken.
Thank you all for
Thank you.
thinking about doing this.
So if Karen is still with us, sorry this took a while, Karen, we're trying to deal with a bunch of other stuff too. So would you like to do the initial presentation of health benefits of the forest? I know you asked us, but I have more general sort of knowledge of that, not specifically about forests.
Right. I think most of us have general information, and we have that huge forest, Mount Standish Forest, and that really affects a huge amount of the population. I'm from North Quincy, I used to be, North Plymouth. And in North Plymouth, we have small little clumps of trees, like mini forests. And so where North Plymouth is urban, the urban part of Plymouth, I was just wondering, what the health benefit of smaller little forests would have on the urban neighborhood in Plymouth. The other information is general, watersheds, trees catch copious amounts of water and allow the infiltration back into the groundwater. The root systems hold the soil, keeping excessive amounts of sediment from polluting the water. And of course, that's directly relative to the health. And the trees help mitigate the effects of climate change. They absorb airborne pollutants, sulfur dioxide, and carbon monoxide. And I wanted to ask you if you could give your opinions from your knowledge, is since North Plymouth is, like I said, more urban, what the effect of the smaller grouping of trees and forests would have beneficially to the population. So that's it. I mean, I could talk more about how trees affect us, but I think it's basically all general information. But I wanted to know, you know, the small grouping of trees and forests in North Plymouth, that, you know, what's the health effect of them to the people who live here in North Plymouth? That's what I needed to know. Thank you.
You know, my knowledge is based upon the idea that getting outside, whether it's sitting by the ocean and hearing the waves, or whether it's just going for a walk and trying to stay away from heavily trafficked areas while you do it, does have positive health benefits, as I think most people know that nowadays.
Yeah.
And I think we try to do it. Certainly where I live, there's extensive walking trails that usually run along roadways, but they also run through forested areas along the edges of the roadways. And some of them actually, the walking trails are not even paved, they just go through wooded areas. And I constantly see people that are either walking dogs or just out walking on their own, that are utilizing those. I don't know if such things exist in North Plymouth. Do you have walking trails or any areas where people tend to go walking that are more heavily treed, that are away from heavily traveled roads?
There's one trail along the railroad section in the back. It goes right along the coast, and it is heavily, it is wooded, and then a field. So there's lots of wonderful trees around that area. But in North Plymouth, there's a hill called High Cliff, and when you look down from that hill, all around the foot of the hill surrounding it, there's lovely little mini forests surrounding that. And then beyond that, a development, and beyond that, another development. So I'm concerned about, you know, those smaller sections of forests, and if they were to go away, how would that, you know, affect the residents in Plymouth, in North Plymouth? So that was my concern. And, you know, that's all.
Yeah, the railroad trail, used that several times myself, and I just learned from an announcement made at the select board meeting that they've installed a water refilling station along that trail.
Yeah.
So the town has actually put a station in where you can get water and refill your water bottles as you walk along the trail, which especially this summer probably is a good thing. Beyond that, I've never heard of that other area in North Plymouth. Do you know anything about it, Karen?
Yes, and there are actually, Karen, I'm glad you brought this up, the arborist out there, the tree people, actually list 22 reasons why you should have a tree in your neighborhood and what it actually brings to your neighborhood. We've already mentioned a couple of them, that they, climate change, they do clean the air because they actually absorb odors and pollutant gases, and this could just be one tree. You know, and we're not talking large forests, we're talking in those smaller little forests that you're talking about, or little tree gatherings. These are still the benefits. They provide oxygen. This is an important one, I think. They cool the streets, and that's what the climate change, I think Karen, you were involved in that a little bit. What they're looking at to do is to build up these small little forests because it's cooling the street and it's cooling the sidewalks. And that helps both with animals and people. They actually conserve energy, because if they produce shade, then we can sort of conserve our other energy by air conditioning or things like that. They absorb water, so they help with water. They prevent pollution. They actually prevent soil erosion, which is huge, especially in a coastal community. Now, this is interesting though, too. We are building a dog park, I think, as you also are aware, Karen, and the folks up in the audience might know. And it was presented last night at the select board meeting. It's going to be in Cedarville behind the animal shelter. And one of the things that they're doing in that dog park is planting trees and saving trees. Like they're going to clear some of the land, but but they are really strategically clearing that land to keep as many trees as they can, to provide shade not only to the animals, but to the people who bring them there. So this is very timely, Karen Edwards, that you're bringing this forward, because it is definitely a topic on all kinds of different departments' minds. The trees provide food. As you can see, like obviously trees that have fruit, but they also have like other things that other little, squirrels and things need. They help reduce noise. They act as a natural noise barrier, and that's also what we're using at the dog park. We're building an arboreal out on the fence to help with the noise of the little doggies barking in the dog park. So we are utilizing all of these things. Let's see, they promote healthy soils. I mean, there's so many different things, Karen. It's just so wonderful that you actually brought it up because it is so imperative. I mean, trees are so important. But what I want you to know, and I want other folks in the audience to know too, is Plymouth is very aware of the value of the forest, no matter what the size is, from the mini forest to the large forest like Miles Standish. We are acknowledging and recognizing the value that it brings. And I will definitely talk to planning and development as well as they continue to do things in your area, the more urban type areas, like you said.
Yeah.
How we can incorporate that, how we can make sure that that continues.
Okay, thank you.
Something about this actually even came up at the NDCAP meeting on Monday.
Yeah, so
Because
important.
there is concern that with global warming and increasing sea levels, that there could be a problem involving what's left of the Plymouth nuclear plant. Even though the dry casks were moved away from the coast and are now 75 feet above sea level. But if sea level continues to rise with a major nor'easter that caused a lot of flooding, there's major concerns that there could be a public health emergency precipitated if salt water, even in the air or by flooding, got its way up to where those dry casks are currently located. And I don't even want to think about the consequences. So there's a sense of urgency, I think, to actually, get that work done without adversely affecting the environment or affecting adversely the public health, the people that live, especially those that live nearby. So, that's also an issue. Trees, in terms of what they do to help sort of mitigate that from happening, they do absorb vast amounts of carbon dioxide. And in turn, they emit oxygen, which is, a very valuable thing. The same thing is happening if you think about the oceans, to the algae. The algae also do the same thing. They absorb carbon dioxide, they emit vast amounts of oxygen. If we keep warming the climate, the algae die. And again, the consequences of that are a catastrophe. So, we have to fight. There was a rally before the NDCAP meeting on Monday, and there were two people from the Wampanoag tribe there, who were going on and on about how it is what they consider a divine duty, but it's everyone's duty to protect Mother Earth and not to further degrade what's already, been done to it. Because eventually we will all pay the price. So
Thank
thank
you
you, Karen.
so much. Thank you so very much. You said a lot and I'm just concerned because, North Plymouth is still building and want to build more. And I'm concerned about the little forests that are left. So you gave me a lot of information. Thank you so much.
You should also know, Karen, that the Public Health Excellence Grant for Shared Services is very, very concerned about health equity. And we're mostly concerned in Plymouth for the North Plymouth area.
Oh,
Because
okay.
we know that there's, people living in that area that are not necessarily very well off. There are people that don't even speak English as a first language.
Yep.
And there's a lot of concerns about, we're gonna make sure that the people who are living up there have equal access to healthcare and health, facilities. So we're working on that also.
Wow, that's awesome. Thank you so much, everybody. Thank you, Karen and
Thank you, Karen.
Mark,
Thank
and thank you.
Have a great-
Bye. Bye-bye.
Bye.
Thank you.
Okay, so very quickly, I don't know if we're getting thrown out today or not, but can you work on that?
Quick money.
Director's report?
Quick as money. All right, so director's report, couple of things I just want to point out, we don't have to go through everything, but. The Massachusetts Department of Public Health has reported 9 EEE positive mosquito samples in Plymouth County as of July 20th. The risk level in the region has been elevated, but for Plymouth, it still stays moderate. However, it's been elevated for Carver because they have a EEE, and it's been elevated in Kingston because they have West Nile virus. So because of that, we're still holding steady at moderate because we border obviously those 2 towns. So again, there's information in our report about ticks and what you need to do about those, but also about the mosquitoes. The number of mosquito samples tested was 3,257. What's happening now is we have 16 positive West Niles, 9 positive EEEs. 30, again, nothing in the horses yet, but 34 humans have been tested, but the good news is nothing showed up in the 34 humans that were tested. So we received an emergency notice on our phones from the Massachusetts Department of Public Health asking us to continue to share this information. So I just want to quickly say, be prepared, your risk, repair any screens that folks might have. Make sure you clean up anything that could be a mosquito breeding site, such as stagnant water. I always talk about, little kiddie pools, wheelbarrows, wear long sleeves and long pants from dusk to dawn. Use mosquito netting on baby carriages and playpens. Wear mosquito repellent when outdoors, especially again between dusk and dawn. And remember to dump any standing water. So that would be on our website, and it continues to be an important area that we'll be mentioning in these reports. From our public health nurse for our month of June, our cases were 49 for Lyme and 21 for flu. We do have 1 cyanobacteria advisory. Clear Pond does indeed have a cyanobacteria bloom. It was effective June 24th, 2024, and it continues.
That actually.
So lifted?
Well, not yet.
Oh.
Today was clear, so we are starting a 2-week countdown.
All right, 2-week countdown, keep your fingers crossed. And then finally, through the Public Health Excellence Grant, which Dr. Poppin had mentioned, myself and Margaret Coe, our health agent, are virtually attending the Nate Show. I always say Nate Show 360, which is a national conference which is happening in Detroit, Michigan. But for the first time, they have offered a viral portion of this conference where you can actually pick the things that you want to go to and workshops that you want to attend. There are certain things we can't go. We can't go to pet therapy because obviously we're not there, so we can't play with all the little pets they brought in. But it's an amazing opportunity, and I really have to, we really want to thank the grant for offering us the opportunity to do that. It's never happened before, and it's fantastic. So that's all I want to say tonight.
Thanks, Karen. Chairperson's announcement, I just have one really positive thing to state. The Massachusetts Department of Environmental Protection finally, after many months, changed their denial of Holtec's request to modify their permit so that they could dump radioactive water into Cape Cod Bay from tentative to final. So Holtec is now banned legally from dumping any radioactive water into Cape Cod Bay. They are currently considering whether or not they want to appeal that decision to the DEP. And then they will have to decide if they want to spend a vast amount of money and time actually appealing the decision to the courts.
Yep.
So that made, a lot of people that were present at that meeting on Monday night very happy. Now we're just fighting them again to try to get them to stop enhanced evaporation of the water, which contains radioactivity, into the air, which we all breathe. So that's ongoing. They're not currently using the heaters, which heat the water up to 95 degrees Fahrenheit and exposes the workers that are working inside that building to probably not only lots of moisture that evaporates from the radioactive water, but some of the radioactive components that are present in the water as well. But that's a subject for another time. Is there any old or new business anyone wishes to bring up?
Yeah, Barry, I just wanted to mention,
Okay.
you know, that the discussion real quickly, the discussion around the forest. One of the companies in Plymouth, 80 Makepeace, has partnered with Sustainable Redbrook, and they created this Miyawaki forest at Redbrook. And it's really, that concept focuses on planting biodiverse native pocket-sized forests, and typically in urban areas with, but it's the first of its type in southeastern Massachusetts. So it was a timely discussion with Karen Edwards, and it's something that you could look at on the 80 Makepeace. I happen to live in Red Brook, so I know, I see emails about it, but it's a nice concept for these tiny forests and installing those. So thanks. Just wanted to
Would they be
recognize.
would they be willing to do that up in North Plymouth or only in the Red Brook area?
I don't know, right? Because, but it's the first of its kind in southeastern Massachusetts. So the concept, you can take a look at it, and other developers, and maybe even the town could take a look at it and say, hey, maybe this looks great. Maybe we could start doing some of these things to the for the benefits that you've outlined, you know, carbon sequestration, you know, cooling, biodiversity, and all of those things. So I just wanted to recognize 80 Makepeace for their efforts on that.
Okay, thank you, Lorenzo. So the last thing we have to do is just entertain a motion to adjourn.
So moved.
Wait a minute, no, I don't recognize it.
$1,000,000.
Would someone make a motion who's a board of health member to adjourn? Dr. Reed makes the motion. Is there a second?
I'll second.
Meg seconds the motion. I have to call the roll. Sorry, I do it again because we have remote people. Dr. Reed, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Meg, yes or no?
Yes.
Myself, yes. Meeting is officially adjourned.